Get your hands off me, Doc. I'm not saying it again. The monitor screamed a rapid tachycardia rhythm. Reed Steele, bleeding heavily from a jagged shrapnel wound across his ribs, shoved the trauma surgeon back against the supply cart. Glass shattered. "Restrain him!" Dr. Foster yelled, wiping sweat from his forehead. 3 security guards rushed forward. Nurse Briella Stone didn't move toward the restraints. Instead, she stepped directly into the combat veteran's striking distance, lowered her voice to a cold whisper, and said 4 words that froze the entire room. 30 minutes before the glass shattered in Trauma Bay 4, the Bethesda Federal Medical Annex was suffocating under the weight of its own sterilized routine. The annex was not a standard public hospital. It was a brutalist concrete structure hidden behind wrought iron gates, designed specifically to patch up the broken pieces of the nation's clandestine operations. Here, patients didn't have names on their charts. They had alphanumeric designations. Briella Stone stood quietly at the center of the trauma bay, her fingers moving with absolute, mechanical precision as she counted the inventory of the crash cart. Epinephrine, atropine, hemostatic gauze, fentanyl. She moved with a stillness that contrasted sharply with the chaotic energy of the hospital around her. Underneath the crisp, pale blue cuff of her left scrub sleeve, hidden entirely from view, rested a frayed, salt-stained nautical knot bracelet. It was woven in a complex double helix pattern, rigid with age and exposure to seawater. Her fingers brushed against it momentarily, a grounding ritual she performed whenever the red phone on the wall began to flash. The phone was flashing now. "I can't get my hands to stop shaking," Magnolia whispered, her voice trembling as she adjusted her face shield. The younger nurse was 23, fresh out of a civilian trauma rotation, and entirely unequipped for the psychological weight of the annex. They said it's a Tier 1 asset, inbound from an undisclosed exfil. ETA is 4 minutes. "Breathe, Magnolia," Briella said, her voice a low, steady current that instantly commanded the space. She didn't look up from the cart. "He's just a man who is rapidly losing blood. We replace the blood. We stop the leak." The acronyms on his file don't change human anatomy. Before Magnolia could respond, the heavy reinforced doors of the bay swung open, and Dr. Zachary Foster entered. Foster was the lead attending physician, a man whose surgical brilliance was matched only by his towering, fragile ego. He wore his white coat like a cape, flanked by 2 surgical residents, who looked perpetually terrified. "Listen up," Foster barked, clapping his hands together. "We have an echo-level clearance incoming. Gunshot wounds, shrapnel, severe blunt force trauma. We need him stabilized, prepped, and in the OR within 10 minutes. I don't want any hesitations. I don't want any fumbling. Stone, you're on the right flank. Handle the lines. Keep your head out of my way." "Understood, Doctor," Briella replied smoothly, betraying zero emotion. She had worked under Foster for 2 years. She knew he operated on a frequency of manufactured panic, believing that fear was the best motivator for his staff. Briella operated on an entirely different philosophy. The loudest man is rarely the most dangerous. The rhythmic, deafening thud of helicopter rotors suddenly vibrated through the reinforced ceiling. The medevac had landed on the roof. Moments later, the bay doors blew open again, this time admitting a storm of noise, wind, and shouting personnel. Paramedics rushed the gurney into the room, their uniforms stained crimson. Flanking them was Fallon, a high-ranking federal intelligence liaison wearing a sharply tailored charcoal suit that looked absurdly out of place amid the blood and sterile plastic. "Clear the path!" Fallon shouted over the din, flashing a badge that no one had time to read. "He's conscious, but he's fading. He has critical operational intelligence. If he dies before he gets to a debriefing room, half his team overseas is compromised. You save him, Doctor. That is not a request." Briella finally looked at the man on the gurney. Reed Steele was not thrashing. Unlike most civilian trauma victims who writhed and screamed under the agony of catastrophic injury, Reed was horrifyingly silent. His tactical gear had been roughly sheared away, revealing a heavily muscled torso painted in soot, sand, and blood. A massive, jagged laceration tore across his right rib cage, still weeping dark venous blood. But it was his eyes that caught Briella's attention. They were a piercing, icy gray, and they were wide open. He was not looking at the ceiling, nor was he looking at the doctors hovering over him. His eyes were darting to the exits. He was tracking the security cameras, He was counting the personnel. His brain was entirely disconnected from the agonizing pain of his ruined body. He was locked in a state of pure, primal combat assessment. On my count, transfer to the bed, Foster ordered, stepping into the fray. 1, 2, 3. The staff lifted the heavy backboard. As Reed's body shifted onto the trauma bed, a jolt of agony flared in his jaw. His left hand, the only limb not currently pinned by paramedics, snapped up with blinding speed. He grabbed the wrist of a resident who had reached for his chest, locking the young doctor's arm into an agonizing joint manipulation. "Ah! Let go!" the resident screamed, dropping to his knees. Reed didn't speak. He just held the wrist, his grip like industrial steel, his gray eyes locking onto Dr. Foster with the cold, dead stare of an apex predator determining whether a threat was worth killing. "Patient is combative!" Foster yelled, stepping back. "Security! Get Mercer down here now. Stone, draw up 50 of ketamine. Knock him out." Briella didn't move toward the drug cabinet. She looked at Reed. She saw the microscopic tightening of his jaw, the specific way his shoulders rolled forward into a defensive shell. She recognized that posture. It wasn't a man lashing out blindly. It was a highly trained operative holding a perimeter. Drugging him now, while his adrenaline was peaking and his heart was hammering at 160 beats per minute, could trigger a lethal cardiac event. "Dr. Foster," Briella said quietly, stepping into the periphery of his vision. "He's not combative. He's disoriented. If you push that much ketamine while his sympathetic nervous system is redlining, his heart will stop." "I didn't ask for a consult, nurse," Foster snapped, his face flushing crimson. "I gave you an order. Now move." Reed suddenly released the resident, who scrambled backward, sobbing in pain. With a terrifying, fluid grace that defied his massive injuries, Reed rolled off the side of the trauma bed. His bare feet hit the linoleum floor. Blood spilled from his side, painting the sterile white tiles red. He staggered backward, pressing his spine against the far corner of the room, effectively putting a wall behind him and eliminating his blind spots. He raised his hands. In his right fist, he held a stainless steel surgical scalpel he had silently stripped from the resident's tray during the scuffle. The room froze. The hum of the medical monitors felt deafening in the sudden, terrifying silence. Reed Steele was bleeding to death, cornered like a wounded wolf, and ready to take anyone with him who stepped into his kill zone. "Nobody move," a deep, authoritative voice boomed from the doorway. Colt Mercer, the Annex's chief of security, stepped into the trauma bay, flanked by 3 heavily armored guards holding riot shields and extendable batons. Mercer was a formidable man, a former Marine military police officer who treated the hospital like a correctional facility. He unclipped the retention strap on his taser, his eyes locked on the bleeding seal in the corner. "Stand down, son," Mercer commanded, raising his hands in a placating gesture that lacked any real empathy. "Put the blade down. You're in a hospital. You're safe." Reed didn't blink. He didn't lower the scalpel. His chest heaved with shallow, rapid breaths, the jagged wound on his ribs bubbling with every exhalation. To Reed, the men in armor were not security. They were combatants. The bright lights were interrogator lamps. The beeping monitors were countdowns. He was trapped behind enemy lines, and his training dictated that surrender was not an option. Up in the glass-walled observation gallery that overlooked the trauma bay, Hospital Administrator Renly appeared, standing next to the federal agent, Fallon. Renly's face was the color of spoiled milk. He pressed an intercom button, his voice piping into the room through the ceiling speakers. "Dr. Foster," Renly said, his voice trembling with bureaucratic anxiety. "We cannot have a violent incident in this facility. Agent Fallon needs this asset alive and capable of speaking. Neutralize the threat and get him into surgery. Do whatever it takes to secure him." Foster, feeling the weight of the administration watching him, bristled. His authority had been completely undermined by a patient who refused to play the role of a victim. Foster turned to Briella, his eyes narrowed into slits of pure venom. "Draw the ketamine." "Stone," Foster hissed. "Now, doctor," Briella said, maintaining her steady, low tone. She kept her hands open and visible at her sides. "Look at his respirations. Look at the pallor of his skin. He's entering Class 3 hemorrhagic shock. If security rushes him, he will fight until his heart gives out. If you dart him with a heavy sedative right now, his blood pressure will bottom out and he will die on that floor." He needs to stand down voluntarily. Foster's face contorted with rage. He stepped toward Briella, invading her personal space, pointing a rigid finger at her chest. "Listen to me very closely, Nurse Stone." Foster spat, his voice carrying clearly across the trauma bay, echoing up to the gallery where Renly and Fallon watched. "You are not a diagnostician. You are a glorified chart keeper. You are here to hang saline bags and follow the orders of the people who actually went to medical school. I do not care how they did things at whatever rundown county clinic you transferred here from. Your job is to obey. If you cannot handle the pressure of treating high-value assets without trying to play psychiatrist, step out of my trauma bay immediately." A heavy, uncomfortable silence fell over the medical staff. Magnolia looked down, her face flushed with second-hand embarrassment. The residents shifted uncomfortably. It was a vicious, calculated public humiliation designed to put Briella in her place and re-establish Foster's dominance over the room. Briella didn't flinch. Her expression remained as unreadable as polished stone. She didn't defend her credentials, nor did she apologize. She simply reached beneath the cuff of her left sleeve and pressed 2 fingers against the rough, frayed knot of her paracord bracelet. "He's bleeding out," she thought, her eyes shifting from Foster's flushed face to Reed's pale one. 90 seconds before irreversible tissue damage begins. 2 minutes before he goes into cardiac arrest. "Get your hands off me, Doc." "I'm not saying it again," Reed suddenly rasped. His voice was like grinding gravel, barely louder than a whisper, but it carried a lethal promise. Foster, fueled by his own adrenaline and the sting of being defied, turned away from Briella and marched angrily toward the supply cart, grabbing a heavy syringe of Haldol himself. "I am not negotiating with a psychotic patient," Foster yelled, wiping sweat from his forehead. He lunged toward Reed with the needle. Reed moved. Despite the blood loss, the SEAL was infinitely faster than the surgeon. He didn't stab Foster. Instead, Reed used his free hand to violently shove the doctor backward. Foster slammed hard into the stainless steel supply cart. Bottles of antiseptic and glass vials crashed to the floor, shattering loudly. "Restrain him!" Foster yelled, scrambling backward on the glass-slicked floor, his bravado entirely evaporating in the face of physical violence. Mercer didn't wait for a second invitation. "Shields up! Go, go, go!" he barked. The 3 security guards rushed forward, raising their heavy riot shields, preparing to crush the wounded SEAL against the wall and beat him into submission. It was a tactical maneuver that worked beautifully in prison riots. Against a Tier 1 operator fighting for his life, it was a death sentence. Reed shifted his weight, raising the scalpel, preparing to drive it through the unarmored gap in the first guard's neck. Briella Stone moved. She didn't run. Running signaled panic, and panic escalated violence. Briella stepped with long, deliberate, silent strides, moving directly across the room and inserting herself seamlessly between the advancing line of riot shields and the cornered SEAL. "Hold!" Briella commanded. It wasn't a shout. It was a sharp, guttural bark that resonated from her diaphragm, a tone of absolute, unquestionable authority that cut through the chaos like a whip. It was a voice that did not belong to a submissive trauma nurse. It was a voice accustomed to calling airstrikes in hostile valleys. The security guards instinctively stutter-stepped, their momentum broken by the sudden appearance of an unarmed woman in their path. Before Mercer could shout an order to move her aside, Briella reached out and slammed her hand against the master control panel on the wall to her right. She hit the red button, marked isolation. Heavy magnetic locks clacked loudly. The thick, reinforced glass doors of Trauma Bay 4 slid shut with a pneumatic hiss, sealing tight. An amber light began flashing above the frame. She had just locked the room from the inside. The only people left inside the containment zone were Briella and the heavily armed, bleeding SEAL. "Stone, what the hell are you doing?" Foster screamed, rushing to the glass doors and pounding his fists against the thick pane. Mercer was beside him, furiously swiping his security badge against the scanner. But the manual override had triggered a 2-minute delay lock. Up in the gallery, Fallon leaned forward, her hands pressing against the glass, her eyes narrowing as she studied the nurse below. Briella ignored the pounding on the glass. She turned her back entirely on the furious surgeon and the bewildered security team. She faced Reed. He was breathing heavily, the scalpel trembling slightly in his grip as his muscles began to fail from oxygen deprivation. He stared at her, waiting for her to attack. Briella didn't raise her hands in surrender. Instead, She dropped into a very specific, relaxed stance. She kept her feet shoulder-width apart, her weight evenly distributed. She lowered her chin slightly, exposing the crown of her head rather than her throat. It was a non-combative posture, but it communicated profound tactical awareness. She wasn't a victim, and she wasn't a threat. She was an equal. Slowly, deliberately, she reached up and pulled back the left sleeve of her scrubs, exposing her wrist. Reed's gray eyes flicked down to her arm. He saw the black, frayed paracord bracelet, the double helix knot. His pupils dilated. Briella looked directly into his eyes. The room around them, the screaming monitors, the pounding on the glass, the sterile white walls seemed to dissolve. She lowered her voice to a cold whisper. "Black water, silent bell," she said. The 4 words hung in the air. They were not a random string of syllables. They were a deeply classified unit rally code, an auditory anchor designed to pull operators out of dissociative trauma fugues during compromised extractions. It meant, the mission is over. The extraction is secure. You are with your own. Reed stared at her. The violent, feral tension in his jaw slowly began to slacken. He looked at her eyes, searching for deception, and found only the calm, unyielding presence of someone who had walked through the same hell he had. His arm lowered. The scalpel slipped from his slick fingers, clattering harmlessly onto the linoleum tiles. Reed's knees buckled. Briella stepped forward instantly, catching him under the arms before he hit the ground. She didn't try to drag him back to the bright, exposed trauma bed. She knew better. She guided him down to the floor, settling him into the corner with his back against the wall, exactly where he felt tactically secure. "I've got you," she murmured, pulling a roll of hemostatic gauze from her pocket. "You're off the clock, brother. Hold the line for me." "Cold," Reed gasped, his head rolling back against the drywall. "It's cold." "I know. We're fixing that right now," Briella replied. Working with blinding speed, she tore open the gauze and aggressively packed the gaping shrapnel wound on his ribs. She didn't hesitate when he hissed in pain. She applied heavy, sustained pressure with the heel of her hand. With her other hand, she reached up, blindly grabbed an IV start kit and a bag of O-negative blood from the lower shelf of the supply cart, and dragged them down to the floor. Outside the glass, Foster was screaming until he was red in the face. Mercer was slamming his shoulder against the reinforced door. Inside the bay, it was perfectly peaceful. Briella seamlessly slid a large-bore IV needle into Reed's forearm, taping it down securely. She connected the bloodline, squeezing the bag to force the life-saving fluid into his collapsing veins. Reed looked at her through half-lidded eyes. "Who?" he rasped, his voice weak but coherent. "Who are you?" Briella met his gaze, maintaining the brutal pressure on his side. "I'm just the nurse who hangs the saline bags," she said quietly. "Keep breathing, Steele. The hard part is over." The amber light above the trauma bay door stopped flashing. The heavy pneumatic seal released with a sharp hiss. Before the metal had fully retracted, Chief Colt Mercer breached the room, his taser leveled, followed instantly by the 3 heavily armored guards. Dr. Zachary Foster was right behind them, his face pale with a mixture of terror and unadulterated rage. They poured into the bay expecting to find a bloodbath, a hostage situation, or a dead nurse. Instead, they found absolute, clinical control. Reed Steele was seated on the linoleum floor, his back flat against the wall. His eyes were closed, his breathing shallow but rhythmic. The scalpel lay abandoned 6 feet away. Beside him, Briella Stone was kneeling in the pooling blood, her posture relaxed but her hands locked in a vice grip over the massive shrapnel wound on his right flank. The O-negative blood was flowing smoothly through the IV she had established. "Threat neutralized," Briella announced, her voice entirely devoid of adrenaline. She did not look up at the security team. "He is in hypovolemic shock. I have temporary hemostasis on the primary laceration, but he has internal hemorrhaging. We have lost 3 minutes of surgical time. Bring the transport stretcher. Now." Mercer lowered his taser, his tactical mind struggling to process the abrupt de-escalation. He looked at the discarded blade, then at the combat veteran who was now docile under the nurse's hands. Mercer nodded sharply to his men. "Shields down. Get the stretcher." Foster, however, could not process the shift. His authority had been usurped, his ego bruised in front of the hospital administration watching from the gallery. He stormed forward, his pristine white coat now speckled with the glass from the shattered supply cart. "Step away from the patient, Stone," Foster demanded, his voice cracking slightly. "You are entirely out of line. You locked a federal medical team out of a trauma bay. I secured a volatile environment and prevented a lethal cardiac event," Briella replied smoothly, seamlessly transitioning her weight as the paramedics rolled the transport stretcher flush against the wall. "On 3, we lift. Magnolia, secure the IV pole. Do not let that line snag." "I am the attending physician," Foster shouted. "Then act like it, doctor," Briella said, her eyes finally snapping up to meet his. The look she gave him was not insubordinate. It was chillingly clinical. "Your patient is bleeding to death. You can reprimand me in mortality and morbidity rounds tomorrow. But right now, you need to scrub in." For a fraction of a second, Foster looked like he was going to order security to drag her out. But the rhythmic, failing beep of the mobile heart monitor cut through his pride. The surgeon in him took over. He spun on his heel, pointing at the terrified residents. "Or 2, move! Page anesthesia. Tell them we have massive trauma, possible hepatic avulsion. Go!" The transition from the trauma bay to operating room 2 was a blur of fluorescent lights and squeaking wheels. Briella moved alongside the stretcher, her hands never leaving the wound, her knees brushing against the metal rails with every step. In the scrub room outside OR2, the tension shifted from explosive combat to hyper-focused precision. Briella stood at the stainless steel sink, aggressively scrubbing her hands and forearms with iodine. As the hot water cascaded over her skin, it soaked the frayed black paracord bracelet on her left wrist. She didn't remove it. She simply patted it dry with a sterile towel before sliding her arms into the blue sterile gown held by a surgical tech. She double-gloved, the latex snapping crisply against her cuffs, hiding the bracelet entirely from view once more. Inside the OR, the environment was a symphony of controlled violence. The air smelled sharp with the tang of ozone from the electrocautery pen and the heavy, metallic scent of blood. Reed was positioned on the table, intubated, his chest rising and falling artificially to the rhythm of the mechanical ventilator. "Scalpel," Foster ordered, standing over the draped torso. He made the initial incision a massive vertical, midline laparotomy to open the abdominal cavity. Blood immediately welled up, dark and rapid. "Suction! Get in here, Stone, I can't see a damn thing," Foster barked, his panic returning as the monitor alarmed, indicating a dropping blood pressure. "He's bleeding out from the liver bed. More laps. Give me more lap sponges." Briella was already there. While the resident fumbled with the suction tubing, Briella smoothly inserted a large pool suction tip into the abdominal cavity, expertly clearing the field of blood without damaging the surrounding tissue. She didn't wait for Foster's next command. She anticipated the anatomy of the trauma. "The hemorrhage is posterior to the falciform ligament," Briella stated calmly, handing Foster a DeBakey clamp before he even realized he needed one. "You have a lacerated hepatic artery branch." "I know what it is," Foster snapped, blindly reaching his hand out. "Stetinsky clamp! Hemoclips! Come on, move your hands." For the next 2 hours, Briella operated not as a subordinate nurse, but as an invisible, guiding force. When Foster's hands trembled, she subtly stabilized the retractors. When he hesitated on a resection, she seamlessly positioned the argon beam coagulator exactly where he needed it. She spoke only in measurements, vitals, and surgical requests. By the time the final layer of fascia was sutured closed, Reed steel was stable. Foster stepped back from the table, stripping off his bloody gloves. He looked at the monitors, breathing heavily. He had saved the asset. He looked across the table at Briella, who was quietly wiping the remaining iodine from the patient's skin. "You're off this case, Stone," Foster said coldly. "You don't go near the ICU. You don't look at his chart. When my shift is over, I am filing a formal report with the nursing board. You're done." The surgical intensive care unit was kept deliberately dark, illuminated only by the soft, blinking lights of multi-channel IV pumps and the rhythmic waveform displays of the central monitors. Reed Steele lay in room 4, a labyrinth of tubes and wires connecting him to life support. The ventilator breathed for him, a slow, mechanical hiss that dominated the quiet space. Briella had not left the floor. Despite Foster's explicit orders, she sat at the charting station immediately outside room 4. She was entering the post-operative fluid intake and output logs, her face an unreadable mask of professional detachment. At 0400 hours, the silence of the ICU was shattered by the sharp clacking of hard-soled shoes. Agent Fallon strode down the corridor, her charcoal suit immaculately pressed despite the late hour. Flanking her were Administrator Renly, wiping sweat from his upper lip, and Dr. Foster, looking simultaneously exhausted and fiercely defensive. Fallon bypassed the nurse's station entirely and walked straight to the glass window of room 4, staring at the unconscious Seal. "We are out of time," Fallon said, her voice tight with suppressed anxiety. She turned to Foster. "I just got off a secure line with Langley. The team Steele left behind is pinned down in a blind canyon. Steele holds the exfil coordinates and the frequency for the local asset extraction. If we don't get those numbers in the next 20 minutes, 12 men are going to die." Renly wrung his hands together. "Agent Fallon, please understand, the patient just survived massive trauma. It's highly irregular." "I didn't ask if it was regular, Renly," Fallon interrupted, her eyes narrowing into cold slits. "I said it is a matter of national security. Dr. Foster, you said the surgery was a success. Wake him up." Foster shifted his weight uncomfortably. He looked at the ventilator, then at Fallon. The institutional pressure was immense. Foster craved the approval of federal authority. It was the currency that bought him funding and prestige. He is currently under a heavy propofol and fentanyl drip to keep him synchronous with the ventilator, Foster explained, trying to sound authoritative. "If we reverse the paralytics and the sedation suddenly, it will be extremely violent. But, yes, from a neurological standpoint, we can wake him." "Then do it," Fallon ordered. "Now." "Nurse Magnolia!" Foster barked, spotting the young nurse hovering near the medication room. "Draw up flumazenil and naloxone. Prepare to push reversal agents. We are extubating the patient." Magnolia froze, her eyes wide with terror. She looked at Foster, then at the medication room, paralyzing indecision gripping her. Briella Stone stood up from the charting station. She did not rush, but her movements carried a heavy, undeniable finality. She walked past Foster, past Fallon, and stepped directly into the doorway of room 4, blocking the entrance to the patient entirely. She crossed her arms over her chest. "No," Briella said. The single syllable dropped into the hallway like a lead weight. Foster's face instantly flushed a dark, dangerous crimson. "Stone, I explicitly ordered you off this case. Move away from that door immediately, or I will have security physically remove you from this hospital." "You cannot wake him, Doctor." "Foster," Briella stated, her voice flat, ignoring the threat completely. "His core temperature is still 34 degrees Celsius. His coagulation cascade is barely holding together. If you push receptor antagonists now, you will trigger a massive catecholamine surge. His heart rate will spike. He will fight the endotracheal tube, and he will tear open the hepatic artery you just spent 2 hours trying to reconstruct. He will bleed to death internally before Agent Fallon can ask him a single question." "I am the lead attending," Foster screamed, the veins in his neck bulging. "You are an insubordinate, arrogant nurse who has no concept of the chain of command. Magnolia, push the drugs." Magnolia took a step backward, terrified, tears brimming in her eyes. She shook her head. Fallon stepped forward, invading Briella's personal space. The federal agent was taller, her presence designed to intimidate. "Nurse Stone, is it? Let me make this exceptionally clear for you. There are 12 Tier 1 operators currently taking heavy fire in an unsecured sector. This man holds the key to their survival. You are impeding a federal intelligence operation. That is a felony." Briella looked directly into Fallon's eyes. She didn't blink. She felt the rough paracord bracelet pressing against her wrist beneath the scrub cuff. She remembered the blinding heat of a similar canyon. She remembered the smell of burning copper, the sound of static on a dead radio. She had made a promise a long time ago regarding the broken bodies brought back from the dark. This was the moral choice. She could step aside, keep her license, and let them kill a man in the name of the mission. Or she could hold the line. "I protect the patient, not the mission." The short, unyielding quote hung in the sterile air of the ICU. "You want his intel?" Briella continued, her voice dropping to a low, dangerous octave. "Keep him alive. You wake him now, you kill him. You kill him, you kill your 12 men. Back away from my room." Fallon stared at Briella, her jaw tight. The federal agent was accustomed to bureaucrats who folded under pressure and doctors who deferred to her badge. She was not accustomed to an unarmed civilian nurse holding a perimeter like a seasoned combat veteran. "You've made a severe mistake, Stone," Fallon said, her voice dropping its volume but increasing its venom. She reached into the interior pocket of her suit jacket and pulled out a heavy, encrypted federal tablet. "Renly, call security. Have her detained. Foster, push the reversal agents yourself. I am pulling this woman's clearance and having her arrested for violating the Espionage Act." Renly scrambled to the wall phone, his hands shaking as he dialed Mercer's extension. Foster, feeling validated, pushed past Magnolia into the medication room to draw the syringes himself. Briella didn't move from the doorframe. She simply stood her ground, her posture relaxed, watching Fallon tap aggressively on the tablet's screen. "Let's see exactly who we are dealing with," Fallon muttered. Accessing the Department of Defense Central Personnel Database. Briella Stone, registered nurse, transferred from civilian sector. Fallon frowned at the screen. "Your file is locked under a Level 5 security mandate. Renly, why does a trauma nurse have a Level 5 encryption on her employment jacket?" Renly, clutching the phone to his ear, blinked in confusion. I don't know. The DoD handles our placements. We just get the personnel." "Fine. I'll override it," Fallon said impatiently. She pressed her thumb to the biometric scanner on the tablet and entered her Echo-level administrative credentials. The screen flashed green. Decryption authorized. The unredacted file loaded. Fallon began to read the screen. At first, her expression was one of angry impatience. Then, her eyes stopped moving. Her brow furrowed. She scrolled down. The color began to drain rapidly from her face, leaving her skin a pale, sickly gray. Down the hallway, Chief Mercer and his security team jogged toward the ICU, their heavy boots thudding against the linoleum. Foster emerged from the medication room, holding 2 syringes filled with clear liquid. "Move aside, Stone!" Foster demanded, marching toward the door. "Security! Remove her!" "Hold on," Fallon said. Her voice was suddenly very small. It lacked any of the commanding resonance it had possessed moments ago. Mercer stopped. Foster paused, turning to look at the agent. Fallon didn't look up from the tablet. Her hand was trembling slightly. She scrolled down again, reading a section highlighted in bold red text. "Agent Fallon?" Renly asked, his voice cracking. "Is there a problem?" Fallon finally looked up. She looked at Briella. The look was no longer one of annoyance or superiority. It was a look of profound, unadulterated shock. It was the look of someone who had just walked into a dark room and realized there was a tiger sitting in the corner. "Dr. Foster," Fallon said, her voice hollow. "Put the syringes down." "What?" "Agent Fallon, we need to wake the asset." "I said put them down, Zachary!" Fallon suddenly shouted, her voice echoing violently down the quiet ICU hallway. The silence that followed was heavy and absolute. Even the hissing of the ventilator seemed to quiet down. The room felt suspended in a vacuum. Fallon slowly turned the tablet around so Renly, Foster, and Mercer could see the screen. There was a photograph of Briella Stone. She looked younger, her hair pulled back tightly, wearing not blue scrubs, but the heavily armored plate carrier and desert camouflage of a Joint Special Operations Command operative. "Nurse Briella Stone," Fallon read aloud, her voice shaking, the words cutting through the institutional arrogance of the men around her. "Serial number 84490 Bravo. Former Chief Medical Operator, JSOC Tier 1 Extraction Team. 2 tours in Fallujah. 3 tours classified. Sole survivor of Operation Blackwater." Mercer's posture instantly changed. The security chief stood up straighter, his hands dropping entirely away from his utility belt. He looked at Briella, his eyes widening in sudden, deep reverence. As a former Marine, he knew exactly what Operation Blackwater was. It was a legend. It was a massacre. "She isn't a civilian transfer," Fallon continued, the realization settling heavily over the room. "She is the highest decorated combat medic in the Department of the Navy, awarded the Silver Star for holding a medical perimeter alone for 14 hours under heavy enemy fire. She was placed here by the Secretary of Defense because she is the only medical professional cleared to handle the psychological trauma of compromised assets." Fallon slowly lowered the tablet. She looked at the frayed, salt-stained nautical knot bracelet peeking out from Briella's scrub cuff. Blackwater. Silent Bell. It wasn't just a code she knew. It was the code of her own destroyed unit. Dr. Foster stood frozen in the hallway, the syringes of reversal agents hanging limply in his hands. The devastating weight of his earlier public humiliation of her crashed down upon him. He had called her a glorified chart keeper. He had told her she couldn't handle the pressure. He had screamed at a woman who had pulled more dying men out of firefights than he had ever seen on an operating table. His massive ego didn't just deflate. It shattered into a million pieces on the sterile ICU floor. He couldn't even meet her eyes. He slowly lowered his hands, staring blankly at the linoleum. Briella's expression remained entirely unchanged. She did not gloat. She did not demand an apology. She stood with the quiet, terrifying stillness of true competence. "The patient stays asleep, Agent Fallon," Briella said, her voice calm and authoritative in the ringing silence. "When his core temperature stabilizes in 6 hours, I will initiate the waking protocol. Then, and only then, you can have your intel." Fallon swallowed hard, sliding the tablet back into her jacket. She nodded once, a gesture of absolute concession. "Understood, Chief." The remaining 6 hours of the night shift at the Bethesda Federal Medical Annex passed with a heavy, unfamiliar quiet. The sterile corridors, usually buzzing with the manic energy of bureaucratic urgency and medical ego, felt different. A tectonic shift had occurred in the hierarchy of the ward. Agent Fallon remained in the surgical observation gallery, drinking bitter black coffee from a styrofoam cup. She did not tap on the glass. She did not make demands over the intercom. She simply watched the monitors in room 4 with a tight, disciplined patience she had not possessed earlier that evening. Inside the ICU, Dr. Zachary Foster was a ghost of his former self. The towering, arrogant surgeon who had screamed orders and shattered glass in the trauma bay now moved with a subdued, meticulous caution. He did not leave the floor to sleep in his on-call room. Instead, he sat at a secondary charting station, painstakingly reviewing Reed Steele's lab results. When he needed a new set of vitals, he didn't bark at the nurses. He approached Magnolia quietly, asking, not ordering, if she could pull a fresh arterial blood gas sample. The institutional blindness had been cured by a massive dose of reality. Foster finally understood that the most dangerous, valuable person in the room was not the one wearing the white coat or the federal badge. It was the woman in the faded blue scrubs who had seen more death before her 25th birthday than Foster would see in a lifetime of surgery. Briella Stone remained exactly where she had been, at the primary charting desk directly outside Reed's door. She did not seek out Foster for an apology. She didn't offer Fallon a reassuring smile. She functioned with the same mechanical, terrifying competence that had saved the SEAL's life. At 0800 hours, the harsh fluorescent lights of the ICU automatically dimmed to a softer, ambient setting to simulate morning for the recovering patients. Magnolia approached Briella's desk, carrying a fresh bag of saline. The young nurse was still visibly shaken, but the terror had been replaced by a quiet, profound awe. She looked at Briella, then down at the frayed paracord bracelet resting against the keyboard. "Chief?" Magnolia whispered softly, unsure of what title to use anymore. Briella paused her typing and looked up. "I'm a nurse here, Magnolia. Call me Briella. Or Stone. Nothing else. Briella." Magnolia corrected herself, swallowing hard. "His core temperature is 36.2 degrees Celsius. The coagulation panel came back normal. His lactic acid is clearing." Briella nodded, her eyes shifting to the monitors visible through the glass. The jagged, chaotic spikes of Reed's heart rate had settled into a smooth, rhythmic sinus bradycardia, the slow, powerful heartbeat of an elite athlete at rest. The ventilator was no longer doing all the work. Reed's diaphragm was triggering the machine, attempting to breathe on its own. "He's ready," Briella said softly. She stood up, smoothing the front of her scrubs. "Go tell Dr. Foster and Agent Fallon. We initiate the extubation protocol in 5 minutes. And Magnolia?" Magnolia stopped and turned back. "Yes? When we pull the tube, I need you to stand by the IV pole and do not move, no matter what he does," Briella instructed, her voice calm but leaving no room for negotiation. "Do not reach for his hands. Do not tell him it's going to be okay. Combat trauma survivors do not respond to platitudes. They respond to parameters. You stay quiet, and you let me anchor him." Magnolia nodded sharply. "Understood." 5 minutes later, the perimeter of room 4 was established. Agent Fallon stood inside the room, but pressed her back flat against the far wall, keeping her hands visible and empty. "Doctor." Foster stood near the ventilator, holding the syringe of reversal agents, his eyes locked on Briella, waiting for her command. There was no arrogance left in his posture. He was yielding to her operational control. Briella stepped to the head of the bed. She leaned over Reed, placing her right hand firmly in the center of his chest. It was a grounding touch, heavy enough to register through the fog of sedation, but not restrictive enough to trigger a fight-or-flight response. With her left hand, she reached out. She made sure the frayed black bracelet was the first thing sitting in his direct line of sight. "Push the flumazenil, doctor," Briella ordered softly. Foster depressed the plunger. The clear liquid vanished into the IV line. "Now," Briella said, leaning her face down so she was inches from Reed's ear. She didn't use a soothing, maternal voice. She spoke in the crisp, flat cadence of a radio transmission. "Steele, listen to my voice. The op is over. You are stateside. You are at the Bethesda Annex. Do not fight the plastic in your throat. I am going to pull it out on the count of 3. Reed's physiological response was instantaneous. The heart monitor's pitch escalated as his resting rate of 50 beats per minute spiked to 110. His eyelids fluttered, heavy and uncoordinated against the paralyzing drugs wearing off. Suddenly, his eyes snapped open. They were wild, dilated, and completely detached from the present moment. He was not in a sterile hospital room. His brain was still trapped in a lightless, suffocating canyon, surrounded by the deafening roar of automatic weapons fire. He felt the rigid plastic endotracheal tube in his throat and immediately panicked, his hands flying up to rip it out. "Hold," Briella commanded sharply. She didn't grab his wrists. She didn't try to physically overpower him. Instead, she pressed down harder on his chest and deliberately brushed the rough paracord bracelet against his cheek. "Black water, silent bell," she said, her voice cutting through the ringing in his ears. "I have the perimeter, brother. Let me pull the tube. Cough for me. 1, 2, 3. The code word struck him like a physical blow. The feral panic in his gray eyes fractured, replaced by a desperate, agonizing clarity. He looked at the bracelet. He looked at Briella's face. He recognized her. Reed forced his hands to drop to his sides, his knuckles turning white as he gripped the bed rails. He coughed violently. Briella deflated the cuff of the endotracheal tube and pulled it free in one smooth, unbroken motion. Reed gagged, sucking in a massive, ragged breath of unassisted air. He squeezed his eyes shut as the agonizing pain of the laparotomy incision and the shrapnel wound flared to life in his nerve endings. The monitors screamed a warning as his blood pressure surged, threatening the delicate surgical repairs Foster had spent hours completing. "Breathe through it, Steele," Briella coached, her hand never leaving his chest. "Pain means you're alive. The bleeding is stopped. You are secure." Reed choked on a dry, raspy cough, opening his eyes. He stared at the ceiling for a long moment, mapping the fluorescent lights, orienting himself to the grid of the acoustic tiles. Slowly, he turned his head and looked at Agent Fallon, who was still standing motionless against the wall. "The valley," Reed rasped, his voice sounding like torn sandpaper. Grid, is." Fallon immediately pulled a digital recorder from her pocket and stepped forward, stopping exactly where Briella raised a single finger to halt her. "Grid coordinates," Reed continued, his chest heaving. 349er. Alpha Tango. Frequency for local asset is 117.4. They are in the cave network, completely blind. Tell the birds to drop ordnance on the southern ridge before they send the ropes down. Fallon typed furiously into her encrypted device, hitting send. She let out a breath she looked like she had been holding for 12 hours. "Coordinates sent. The quick reaction force is airborne. We have them, Steele. We're bringing them home." Reed closed his eyes, the immense, crushing weight of his duty finally lifting off his shoulders. The combat tension that had kept him alive for the past 48 hours evaporated, leaving behind nothing but the agonizing reality of a broken body. His heart rate began to drop back down to a safe, sustainable rhythm. Dr. Foster, standing near the ventilator, silently let out a breath of relief. The arterial repairs had held. The waking protocol had been flawless. He looked at Briella, offering a single, subtle nod of absolute professional respect. She returned it with a brief, acknowledging blink. Fallon stepped closer to the bed, her demeanor entirely transformed. She looked down at the heavily wounded SEAL, then shifted her gaze to the nurse holding his chest. "Chief Stone," Fallon said softly, using the military title with deliberate reverence. "The Department of Defense owes you a profound debt. Your actions tonight saved a Tier 1 asset, and because of that, You just saved 12 more men. I will be updating your file personally to reflect this. Briella finally removed her hand from Reed's chest. She pulled the blanket up over his shoulders, her expression unreadable. You don't owe me anything, Agent Fallon, Briella replied smoothly, stepping back from the bed. Just make sure those men actually get on the helicopters. We have enough ghosts. 2 days later, the Bethesda Federal Medical Annex had returned to its standard, suffocating routine. The sun was setting, casting long amber shadows across the courtyard visible from the window of ICU Room 4. Reed Steele was sitting up in bed at a 45-degree angle. The heavy IV lines had been reduced to a single saline drip. His color had returned, the deathly pallor replaced by the rugged, weathered complexion of a man who lived under the sun. The door pushed open quietly, and Briella walked in. She was out of her scrubs, wearing a simple gray sweater and dark jeans. Her shift was over. Reed looked at her, his gray eyes clear and sharp. You're leaving. My rotation is done, Briella said, walking to the foot of the bed and picking up his chart. She reviewed the numbers out of habit, not necessity. Doctor, Foster says you're healing at an accelerated rate. They're transferring you to the Walter Reed Recovery Wing tomorrow. Foster hasn't looked me in the eye since I woke up, Reed noted dryly, a faint, grim smile touching the corner of his mouth. You terrified him, Briella replied flatly, setting the chart down. And then I humiliated him. But he's a good surgeon. He'll learn from it. Institutional arrogance is a disease. Steele. Sometimes it just takes a violent shock to the system to cure it. Reed shifted uncomfortably, grimacing as the stitches in his ribs pulled. He looked at Briella's left wrist, where the cuff of her sweater was pushed back just enough to reveal the black paracord. Black water, Reed said quietly. The words hung in the quiet room, heavy with unspeakable history. I was in Coronado when the after-action report came across the wire. 5 operators pinned down in an ambush. Exfil compromised. The medic dragged 3 of them into a fortified bunker and held off an advancing element for 14 hours with an M4 and a sidearm while keeping the wounded alive. They said the medic was a ghost. They redacted the name on the citation. Briella looked out the window at the setting sun. She didn't offer a dramatic speech. She didn't need to. The people who understood that kind of darkness didn't require translation. I made a promise to the men I couldn't save that day, Briella said softly, her voice barely above a whisper. I promised I would never let another operator die on a table because some bureaucrat was in a hurry or some doctor wanted to protect his ego. I am done fighting wars, Steele. But I will not let them break you here. Reed reached out his left hand. Briella stepped forward and took it. His grip was no longer the crushing, desperate vice of a dying man. It was firm, warm, and deeply respectful. You held the line, Chief, Reed said, his voice thick with emotion he rarely allowed himself to show. Thank you. Briella squeezed his hand once before letting go. Rest up, brother. The real fight is the physical therapy. She turned and walked out of room 4. In the hallway, Magnolia was standing by the charting desk. The young nurse stood up a little straighter as Briella approached. Dr. Foster was walking down the corridor in his pristine white coat. As he passed Briella, he didn't demand she step aside. He paused, stepped slightly to the right, and offered a quiet, respectful, "Good evening." Nurse Stone. "Good evening, doctor," Briella replied smoothly. She walked toward the heavy double doors of the ICU exit, her footsteps silent on the linoleum. She had no superpowers, no rank, and no desire for recognition. She was simply a professional who had walked through the fire and learned that true power isn't about being the loudest person in the room, it's about being the most capable when the world falls apart. The Navy SEAL's secret code is a testament to the profound, quiet strength of those who serve in the shadows. True authority isn't granted by a title on a door, a badge, or a pristine white coat. It is earned in the crucible of absolute pressure. Briella Stone's journey reminds us that the greatest acts of heroism often happen in silence, far away from the battlefield, in the sterile halls where institutional arrogance threatens to eclipse human dignity. It is a story about honoring the unspoken bonds of those who sacrifice everything, recognizing that sometimes the most dangerous person in the room is the one who refuses to raise their voice. If you found this story compelling, please hit the like button, subscribe to the channel for more original cinematic narratives, and let me know in the comments below, how would you have handled Dr. Foster's arrogance?